When a man starts losing confidence in his body, it doesn't just affect the bedroom, it affects everything. You feel stressed, disconnected, maybe even embarrassed. But here's the truth. A softer erection isn't a failure. It's your body trying to tell you something important. I'm Dr. Emily Carter, and today, let's talk about what your erection really says about your health. Because your erection isn't just about sex, it's about blood flow, hormones, nerves, and your overall well-being. If it's changing, your body might be giving you an early warning sign. Let's find out what that means and what you can do to take back control. When patients ask me, "Doctor, how hard is hard enough?" I always tell them there's actually a medical way to measure that. It's called the erectile hardness score, and it ranges from 1 to 4. A score of 1 means the penis is enlarged but not firm enough for penetration. 2 means it's firm but not fully rigid, enough for intercourse but not satisfying. 3 means it's hard enough for penetration and mostly rigid. And 4, that's what we call a completely rigid erection. Now here's what most men don't realize. Your score doesn't define your masculinity. What matters most is function and satisfaction. Are you able to have intercourse comfortably? And are both you and your partner happy with it? Because the truth is, there's no research that says your partner will notice the difference between a 3 and a 4, but you will notice how confident or anxious you feel. That emotional part, the stress, the self-doubt, can have a bigger impact than the physical change itself. So rather than obsessing over perfection, think of erection strength as a vital sign, like blood pressure or pulse. It tells us about blood flow, hormones, and nerve health. If you start noticing softer erections, it may be your body's early warning that something deeper, like circulation or hormonal balance, needs attention. When men start noticing a change in firmness, the first thought is usually, something must be wrong with me. But in reality, it's not one single cause. Erections are a team effort. Your heart, hormones, nerves, and brain all have to work together. So let's talk about the 4 most common reasons why things might start to change, and what you can actually do about each one. Your erection is powered by blood. So if blood can't flow freely, it can't fill the chambers of the penis properly. The arteries in your penis are tiny, much smaller than the ones that feed your heart or brain, which means they show signs of blockage first. That's why many urologists call erectile changes an early warning sign for heart disease. If you notice your erections aren't as firm or don't last as long as they used to, it might not be just aging. It could be your body whispering, "Hey, your circulation needs help." Walk at least 30 minutes a day. Even slow walking improves blood vessel elasticity. Choose foods rich in nitric oxide, beets, spinach, and pomegranate juice. Cut back on smoking, sugar, and fried food. They all damage the arteries that keep you firm. Testosterone plays a key role in energy, mood, and libido. But as you age, your levels naturally dip, sometimes faster if you're stressed, sleep-deprived, or overweight. Low testosterone doesn't just reduce desire, it also makes it harder for your body to respond when you're aroused. Prioritize sleep. Most testosterone is made between 11 p.m. and 2 a.m. Strength train 2 to 3 times a week. Reduce belly fat. Visceral fat converts testosterone into estrogen. Get your levels checked, especially if you notice fatigue or low motivation. Sometimes a small lifestyle change can make more difference than any pill. Antidepressants, blood pressure pills, and certain cholesterol drugs can interfere with arousal and performance. That doesn't mean you should stop them. It means your doctor can help adjust the dose or switch to something that's gentler on your libido. Don't suffer in silence. Tell your doctor when the changes started. Ask if your medication could be contributing. Some alternatives, or timing your dose differently, can improve function without sacrificing mental health. When it comes to your health, you are the one holding the ball, not your doctor, not your medication, you. So many men assume that once they've seen a specialist, their job is done. But real progress happens when you become the quarterback of your own care. Here's what I mean. Let's say you're seeing a urologist for erectile changes, a psychiatrist for depression or anxiety, and maybe a primary care doctor for general checkups. All three might be giving great advice, but if they're not communicating, they could be working in 3 different directions, and that's where things fall apart. So here's the first step. Start the conversation. Tell your doctors, I'd really appreciate it if you could share notes with my other specialist. It's not demanding, it's smart. Your care becomes smoother, faster, and far more effective when everyone's on the same page. A lot of men wait far too long before getting help. They tell themselves, it's just stress, or I'll fix it later. But here's the truth. The earlier you talk about it, the easier it is to treat. So when should you see a doctor? Here are a few simple signs. If you can't get or keep an erection at least half the time you try, that's a sign to check in. If your erections used to be strong but are slowly getting weaker, it could mean something's changing in your blood flow or hormones. If your problem started after a new medication, especially antidepressants or blood pressure pills, that's important to mention. And if you feel anxious, frustrated, or ashamed every time intimacy comes up, that's just as important as any lab result. Because erections aren't only physical, they're emotional too. When one part of that system is off, the other reacts. When you do go in, don't just say, I have ED. Instead, describe what's happening, when it started, and how often it happens. Often it's us. How it feels, physically and emotionally. That level of detail helps your doctor find the real cause, not just treat the symptom. You might be surprised. Sometimes the solution is as simple as adjusting a dose, managing stress, or improving circulation. Let's talk about what you can do right at home to naturally support stronger, more reliable erections. Because while medication can help, your daily habits are what keep those results lasting. You don't need a gym or heavy weights, just walk. A 30-minute walk each day improves blood flow to your heart and to your penis. Think of it as training your circulation. If you can add a few light squats or stair climbs, even better. Exercise releases nitric oxide. That's the same molecule medications try to boost, and your body makes it naturally when you move. Foods that are good for your heart are good for your erections. Try to include leafy greens like spinach and kale, packed with nitrates that open up arteries, beets and pomegranate juice, natural nitric oxide boosters, fatty fish like salmon, full of omega-3s to reduce inflammation, nuts and seeds, rich in vitamin E and zinc for hormone balance, and don't forget to hydrate. Even mild dehydration reduces blood volume and energy levels. Most men don't realize they have pelvic muscles too, and they matter. Doing Kegel exercises, the same ones women do, can help you control erections and prevent premature loss of firmness. Just tighten the muscles you'd use to stop urinating midstream. Hold for 3 seconds, then relax. Do that 10 to 15 times, twice a day. Simple, effective. Testosterone is made while you sleep. If you're sleeping less than 6 hours a night, your hormone levels can drop by up to 20%. Try to go to bed at the same time every night. Keep your room dark and cool, and avoid phone screens for at least 30 minutes before bed. Stress releases cortisol and adrenaline, which constrict blood vessels and kill arousal. Try deep breathing before bed. Inhale for 4 seconds, hold for 4, exhale for 6. Even 5 minutes of calm breathing can lower your blood pressure and help your body switch from fight or flight to rest and respond. Alcohol might relax you in the moment, but too much numbs the nerves that control erection. And smoking, it's the fastest way to damage the tiny arteries that supply your penis. If you quit now, those vessels begin repairing themselves within weeks. Never underestimate emotional intimacy. Touch, laughter, and comfort release oxytocin, the bonding hormone that enhances physical response. Sex isn't a performance, it's communication. The more relaxed and connected you feel, the stronger your body responds. You don't have to change everything at once. Pick 1 or 2 habits, build consistency, and give your body time to respond. Improvement is gradual, but it's real.